Hello everyone, welcome to NCSL's webinar, Healthcare Waivers, 1332 State Relief and Empowerment Waivers webinar. My name is Haley Nicholson and I will be moderating the webinar today. I'm the Policy Director of Health for the State of Federal Affairs team with NCSL. Today's webinar is a platform for information exchange and engagement with our partners from the Department of Health and Human Services and state insurance leaders. Over the next 60 minutes, we encourage participation through our chat box, so please feel free to type your questions and answer any questions in the chat box, which is located in the lower left hand of your screen. To begin building some comfortability with the chat function and to also learn who is on the line today, I invite you to type in the state from which you're calling in now. I also want to briefly mention some of the resources we're sharing. Above the presentation, you will see a couple of different tabs, with one of them labeled Resources. Here you can find and download a PDF version of the PowerPoint shared, as well as some other handouts that are included. Another tab is labeled Speaker, where you can read the bio of today's speakers. You can access these tabs at any time during the presentation. Today's webinar is being recorded and will be available on NCSL's website within the week. Let me introduce today's speakers, and then we can get started. We're going to hear from Randy Pate, CMS Deputy Administrator and Director of the Center for Consumer Information and Insurance Oversight, also known as CISIO. Then we will hear from Lena Reid, Senior Policy Advisor to the Deputy Director of CISIO, and then Michelle Koltov, Senior Policy Advisor to the Deputy Director of CISIO. For our state speakers, we will hear from J.P. Whiskey, former Deputy Insurance Commissioner at Office of the Commissioner of Insurance in Wisconsin. And our last speaker will be Michelle Eberly, the Executive Director for the Maryland Health Insurance Plan. Thank you everyone for joining us. Thank you to our speakers for making the time. Randy, please go ahead when you're ready.
Thank you, Haley. Appreciate it, and thank you everyone so much for being on the call today. We're really excited about this topic. So when this administration came on board a couple years ago, we really heard a strong message from governors, regulators, legislators, and others who were interested in leveraging the options available under Section 1332 of the ACA to improve their markets. But we also heard that states did not have the flexibility they needed to really craft solutions that work on the local level. So what we heard was that the previous guidance that had been issued was overly restrictive for states and really hampered efforts for states to think innovatively regarding how they can improve their markets under this statutory authority. So last fall, we issued some new guidance around Section 1332 and sort of renaming them State Relief and Empowerment Waivers under this new flexibility. We also issued 4 waiver concepts in a discussion paper that really provide 4 examples of how states can use the flexibility provided by the updated guidance to address issues in their markets. So under Section 1332, we believe this flexibility provides a great opportunity for states to address many of the problems with their individual health insurance markets and increase coverage options for their residents, while at the same time adopting innovative strategies to reduce overall healthcare spending. The great thing about these waivers is that you can use them to really improve your market, whether it's small group or individual in your state. We've heard from some states that they want to use reinsurance waivers. We have already approved 7 of these waivers, and we have seen them provide immediate reductions in premiums for people ranging from 30% in Maryland, which you're going to hear from Michelle today about that, as well as 8% in Oregon, so a range of reductions there. And JP, Wisconsin falls a little bit in the middle, but we have something that's already been road tested. That's the key point here. And so we have the advantage of being able to leverage those states' work, in talking about those waivers. But reinsurance, I think everyone on the call would agree, is not necessarily for every state. We recognize it as a positive step in the right direction, but it's not the only answer. And so, there are concerns beyond those that can be addressed by reinsurance. And we're hearing from states about issues in their markets. I'll give you one example. A couple of states have come to us expressing the concern that people, especially those who are above 400% of the federal poverty level are really priced out of the market in their state, or they're concerned about making sure that they have competition needed to drive up innovation and really push down prices. So that's where you can take advantage of the Section 1332 state relief and empowerment waivers to address those problems in your state. And as Lena and Michelle are going to walk through, they are the leads for CISIO in this area, the Section 1332 waivers. We are available to work with you and your team to achieve your vision. We really want to hear from you about the issues you see and help you think through the best way forward. That's why we're doing this call. And one last thing I will try to emphasize before we get into the meat of the presentations here, you can right-size a 1332 waiver to your state's needs. Some states really are looking at more laser-focused solutions to help people with skyrocketing premiums and are looking to take action maybe this year. But other states are thinking about a new vision for health care for people in the individual and small group markets. These waivers offer the flexibility needed to work on both of these ideas. For example, you can pursue a waiver under Section 1332 to focus on a particular region. So a waiver doesn't have to be statewide, for example. But Lena and Michelle are going to get into all those details. I just wanted to, again, thank you for inviting us to be on the call and just reemphasize, if you are interested in this flexibility, come in and talk with us. We're always willing to have conversations and help you think through options for your state. Thank you.
Thank you, Randy, for kicking us off. Lena and Michelle, please go ahead.
Great. Hello, everyone. So what we're going to try to do today is give you a little bit of an overview of the guidance and waiver concepts that Randy just mentioned. So to start off, as we talked about, there are two things we released in the fall, the guidance and the waiver concepts. The waiver concepts very much build on the guidance and kind of provide some new ideas for states to consider with the new flexibility provided. So just to start off with a baseline of what a Section 1332 waiver is, Section 1332 of the ACA is a section that kind of called for states to kind of develop their own innovative ideas, their own state solutions, and there are kind of guardrails that are established that we'll talk about throughout. You have to meet certain criteria, which are the guardrails, and those are coverage, comprehensiveness, affordability, and deficit neutrality. So what that really means is we are evaluating whether the new state plan, the waiver, provides access to comprehensive, affordable coverage to as many people as it would have had in the current climate. We're looking at if you're covering as many individuals as you would have without a waiver, and then we're making sure that this new plan doesn't increase the federal deficit in any way. So currently, states can apply for waivers for up to a 5-year period. States have flexibility there. They could apply for up to 5 years. They could apply for fewer years if that's kind of what the state waiver requires. And we do have, processes in place for states that want to extend their waivers as well. And the statute actually called for this to be a joint program by the U.S. Department of Treasury and U.S. Department of Health and Human Services, that both our departments try to work closely with states and do review of state applications. So getting into the details of a Section 1332 waiver, there are actually specific provisions of the law that you can waive through a 1332 waiver, and we've kind of outlined the specifics of the statute that you can waive. And so as you'll see here, it's kind of different provisions related to an exchange, activities of an exchange. You can waive the premium tax credit structure and also the employer shared responsibility. So they're kind of joint provisions from HHS and from Treasury that a state can waive to implement their new state plan. So again, this kind of provides some more tangible examples. You can waive the establishment of an exchange. You could waive the open enrollment period. You could waive certain requirements of what's sold on your marketplace, like a QHP. You could also waive the single risk pool, metal levels, and the essential health benefit package. And again, just to highlight some certain things that cannot be waived because they are not waivable provisions. You cannot waive anything around pre-existing conditions, the rating factors, guaranteed availability, so a lot of the provisions in the Public Health Service Act, the risk adjustment program, and anything that kind of impacts the determination of other programs like Medicaid or BHP or the like. So as Randy talked about, one of the major benefits of doing a state innovation waiver is that you can really develop a state-developed solution that works for your state. Another incentive for states pursuing waivers is this idea of pass-through funding. So if your state waiver saves the federal government money on premium tax credits or small business tax credits, those savings, which we'll call pass-through savings, can be passed on to the state to implement their state waiver plan. So rather than a state coming up with their own state solution and having to pay for it altogether, as you'll see on the slide, if your waiver plan results in savings in premium tax credits because potentially you are, making sure there are lower premiums in your state, maybe you're having a healthier risk pool, kind of all of those benefits can be passed on in terms of savings to the state to kind of implement their state plan. And as you heard Randy talk about, we have 7 states that have already done reinsurance waivers. Again, we see a lot of opportunity for other innovation in state markets that see reinsurance as a tool, which, as you'll hear from colleagues in our states that have these waivers, can help reduce premiums anywhere from 8 to 30%. So to kind of dive into the new flexibilities in the guidance, they all kind of center around the guardrails, as you see here, and we will continue to kind of talk through those in more detail on these slides to come. So the first new thing that I wanted to highlight here are the principles that we've talked about in the guidance. So what we've asked states to do that are submitting new waiver applications is describe, if applicable, how their state waiver kind of aligns with these principles and talk about their state plan in that context. Since these are new, I want to talk through this in a little bit more detail. The first is provide more affordable access to private market coverage. In that sense, we want to make sure that there are opportunities for consumers to have private coverage options. We also, in this principle, strongly, encourage states to think about market competition, where they can kind of increase issuer participation is all looked at favorably in line with this principle. The second principle is on encouraging sustainable spending growth. So we do encourage states to look at, state innovations, state-level regulations to kind of curb the overall increase in healthcare spending and kind of different things states can think about there. Our third principle is fostering state innovation. So we definitely want, by definition, the state innovation waiver is, helping foster innovation. But I think what we want to see is states kind of talking through how this really innovates in their state, how it's being state-centric in that sense. The fourth principle is supporting and empowering those in need. So we definitely recognize that financial assistance is valuable and helpful to certain populations, and in state waiver applications, we encourage states to think about the impact on those with low income or high expected healthcare costs. And then the last one is promoting consumer-driven healthcare. So we want consumers to be more engaged in their healthcare and kind of picking what healthcare works for them. And so in that sense, we want people to have resources and information as they do pursue their healthcare options. So the guardrails are amended to be more flexible, as kind of Randy talked about, more workable for a state. So the first 2 guardrails we want to talk about are affordability and comprehensiveness. And so we are comparing what exists today in the current market with what's available through a waiver. And we want to make sure that consumers have access to whatever they had today, but hopefully have access to other options as well. And we listed these together because we really are looking at these 2 guardrails together. And so when we're comparing what's available with the waiver, we want to see if that new plan is as affordable and comprehensive as what's available today. But it doesn't mean everyone has to purchase the same thing. So the old guidance, you had to have the same number of people, for example, purchasing a plan with EHV. And what's important with this guardrail is that the same number of people have access to a plan, for example, with EHV, but then they have the option to select something different if it meets their needs. The next guardrail is a coverage guardrail, and so here we are measuring if the same number of people have access to coverage and actually purchase coverage. And so we're looking at how many people have coverage today and how many people are actually purchasing coverage with a waiver. And so what we're doing here is we're making sure that you have the same number of people kind of covered in the aggregate. We did also expand the definition of coverage. And so we are still looking at the number of people with minimum essential coverage. Again, that includes student health plans, that includes individual market plans, that includes association health plans, Medicare, Medicaid. But we also built off of that definition to include the federal definition of insurance. And so when we're measuring this number count of the number of people with insurance, this expanded definition also allows for hospital indemnity plans. It allows for short-term limited duration plans to also count in this overall number count for the number of individuals covered. So to provide an example of how we're looking at the guardrails, in your baseline, which is referred to as a without waiver, perhaps 100 consumers have access to a plan with EHB that is affordable to consumers today. With a waiver, you could provide that 100 people still have access to that same plan, but maybe only 85 people purchase that plan. Maybe those other 15 people decided to purchase something that's a non-QHP. Maybe they purchased a plan that doesn't have the full set of essential health benefits. Under this new guidance, that would be permissible in that respect because you had access to the plan even if consumers did not all purchase the plan. A new flexibility we also provided is that we are looking at the impact across the board for all state residents rather than looking at subpopulations. But in alignment with the principles we talked about earlier, we still want to look at the impact of the waiver on those with low incomes and those with high healthcare costs. Particularly for comprehensiveness and affordability, we encourage states to kind of look at the impact on those populations with those guardrails. In looking at this in the aggregate, we are looking at, whether it's more affordable or less affordable for certain populations, and we'll take into account how much of an impact that's having. So for example, if you make it less affordable for some people, but more affordable for a greater number of people, that could be looked at favorably in terms of review of the guardrails. If, for example, you are making it more unaffordable for a large number of people and affordable for only a few more, that wouldn't necessarily meet the guardrails. And then the last guardrail is deficit neutrality. This largely is very similar to the 2015 guidance. You still have to make sure you meet deficit neutrality for each year of the waiver, and if it does not, your waiver will be less likely to be approved. We did make some small changes just to clarify that we are looking for the information on a yearly basis. And again, with pass-through funding, we also made very small changes. We did clarify that, we will look at any changes in federal state law when we're looking at the pass-through funding. Essentially, like to give you examples of what that's meant in the past, for the waivers that we have in place, when the individual mandate was zeroed out, that had, an impact on our overall federal revenue that we were receiving, so we did make that change. If, for example, your state made a change that kind of impacted the number of people in the individual market, we would certainly take a look at that as well. So, for example, if your state expanded Medicaid, that would change the number of people in your market, and we would take that into account for a waiver. We still do require an actuarial and economic analysis as part of, a state submitting a waiver application, and so we are looking at that to really show what's the impact of your waiver plan on each of the guardrails. And so in that actuarial and economic analysis, we look for information on premiums and enrollment, PTC spending, kind of different changes by different FPL levels. We also look at the assumptions that the state used for their application, the details of their state plan, and kind of how that's evaluated. One of the things that's really important for states to do during their actuarial and economic analysis is kind of identify any federal assumptions they're using and how it may be different for a state. So, for example, if you're using state-specific data and that's different from what a federal data is used, describing why that's different, describing what's different about your state and your impact of the analysis is something that we all look at very closely. And then in the new 2018 guidance, we actually have some new operational flexibility. So we were really excited to share that. So on the FFE platform, we talk about how on the consumer-facing side of healthcare.gov, there's some new opportunities with direct enrollment, perhaps if you want to display things differently. And we also, as we talk more later, we'll talk about some of the waiver concepts. But for a state that wants to take on some new responsibilities and maybe do some different things with the PTC structure, there is some back-end support that the federal government could provide. And if, we do provide that for a state, we would charge for that, but it's some new flexibilities that we're very excited about as well. On the IRS side, as the IRS does administer the premium tax credit, we really don't have flexibility right now to administer different premium tax credit structures for different states, but we do have an opportunity to use the IRS to still administer premium tax credits for states that maybe haven't expanded Medicaid and do want to offer tax credits for those under 100. With either of these flexibilities, on healthcare.gov or with the IRS, we definitely encourage states to talk to us early in the process so we can kind of work out details and see what's feasible for a state. And then another flexibility we were really excited to talk to you all about today, we're hoping there's legislators and staff on the phone today as well, is a requirement for state legislation. So Section 1332 waivers do require that a state has a law to provide the state the ability to pursue the waiver. And so what we did in this guidance is we provided some flexibility here for states that maybe have a law in place to implement the ACA, that if they do have that, they can couple that with an executive order or a regulation to kind of meet the requirements for a Section 1332 waiver. So again, like you've heard from us before, we definitely encourage states to kind of reach out to us early in the process. We are happy to review states' legislation to see if it provides authority to pursue a waiver, but do want to emphasize you do need to have a state law in place to implement the ACA, and then you can couple it with an executive order or regulation. You cannot only have a regulation or executive order to provide the authority to pursue a waiver. And the other thing we definitely encourage states to do is, even if you were pursuing a waiver down the road, we definitely encourage states to kind of think about that authority early on. Whether a state wants to pursue a waiver or not, just having that authority is a good opportunity for states to kind of have that flexibility so that if they do want to pursue a waiver down the road, they have that built in. So here we provided a few examples. These are specific to, reinsurance waivers or high-risk pool waivers. But in the first example, perhaps the state wants to pursue a high-risk pool waiver. Maybe the state has an existing law that provides statutory authority for the DOI to implement the ACA. They use that general law and authority to implement the ACA, and then they couple it with an executive order, and then maybe the DOI would pursue regulations to reenact their high-risk pool so that they could use that as a funding mechanism. Another example we've given here is for a state to implement a reinsurance program. Maybe a state has an existing law that provides authority to implement the ACA. The DOI could issue regulations for perhaps the parameters of the reinsurance program, and then maybe the state would pass new legislation for just the funding component of the reinsurance waiver, making that contingent on approval. So these are just some illustrative examples. We definitely encourage states to talk to us throughout the process. But we do understand, some states have limited windows for their legislative sessions or maybe meet every other year. And this is meant to provide some flexibility for states as they're thinking through that process. The next few slides go over kind of what's not really changed much based off of the guidance. And so the public input process is largely the same. We still require states to have a 30-day public comment period and federal tribal consultation, if applicable, before they submit a waiver. And then for states, as they go through the application process for state waivers that are complete, we do still have a 30-day federal comment period as well. We also, talk through the process for coordinated waivers with 1115 waivers and 1332 waivers, and so that is largely unchanged. And as we've highlighted here, you cannot count the savings from an 1115 waiver towards 1332 deficit neutrality. So to talk a little briefly, as Randy mentioned, we did put out model waiver concepts. Those 4 concepts are kind of listed here, and they're all meant to kind of be ideas for states to kind of think through, almost like a puzzle. You could do multiple waiver components in one, or maybe just one waiver component, but they're meant to be opportunities for states to kind of think through state solutions. The state-specific premium assistance waiver option talks through opportunities for states to administer their own subsidy program. This could be attractive for states if they want to do a state subsidy structure that maybe addresses a subsidy cliff, as Randy talked about earlier. Maybe you want to do a different subsidy structure that goes across different FPL or different populations. The adjusted plan option talks about the opportunity for states to maybe offer plans that are not QHPs and maybe are different sorts of plans. Perhaps you're looking at value-based purchasing plans. Maybe you're looking at different benefit sets. And very much that couples very much so with the premium assistance model if you're administering a state subsidy program. For states that maybe want to stay on the FSE platform, that waiver concept talks about expanding catastrophic plans to a broader eligibility group, and you also could consider catastrophic plans with premium tax credits. The third option is the account-based subsidies option, and is one that our administrator is very excited about. This provides an opportunity for states to kind of think about an account-based model where a state maybe pursues different sorts of plan options with an account that the consumer could then use for their premiums or other healthcare needs that could kind of work with the consumer as they move into different types of coverage. And the last option is the risk stabilization strategies, where we talk about reinsurance waivers. Obviously, there are different reinsurance structures. Some states have looked at it as a claims attachment point model, some have looked at it conditions-based, and some have looked at a hybrid of both. And we also talk about high-risk pools and the opportunity to kind of use them as different sorts of plans to attract different consumers into the market and perhaps lower premiums by taking out some high-risk individuals. So we have these up on our website. We have a lot more information about those, and we're happy to talk to states about these ideas and how they can adapt them to their state needs. I want to emphasize what Randy said earlier. Michelle and I are available to talk to all of you. I think we think of these very much as just an evaluation of your state market, where you think there's opportunities for change, and where a waiver could be an opportunity to kind of strengthen your market. We want to work with states on those opportunities. The last two slides do kind of include additional information where you can find more information about what the guidance says. This presentation is publicly available, as well as our checklist for reinsurance waivers, which I know a lot of states have found helpful. And then we have our contact information. There's an email box here. This is not just an email box that doesn't go anywhere. This literally goes to Michelle and I, and we look forward to kind of engaging with states through this process. It is never too early to talk to us, and we really do look forward to working with legislators and states and others across the board. And really, you're going to hear from some experts in the states right now who really went through this process and really examined their markets to see what works for them. And so we hope you enjoy hearing from them and really look forward to working with you in the future. So with that, we'll pass it back over to the folks at NCSL, and I think we're hearing from Wisconsin next.
Thank you both so much for giving us that overview. And yes, JP, you are up.
Great. Thank you for having me here today. I wanted to highlight a couple of things and take a step back. You can see sort of what we're going to talk about in the slides in that first slide. As we move in, I think it's very important for folks to understand what we're not talking about in this market. Most people do, in fact, receive their coverage outside of the individual market. The individual market is a very small market. You can see there group coverage is not part of it. All the public coverages are not sort of part of this broader discussion. And I think that's important to note from a legislative standpoint. As you look at the individual market, again, it's roughly about 5% of a state's population, give or take. Some states are a little bit smaller, some states are a little bit bigger. You're looking at a population that is really a residual market. These are people who cannot get coverage elsewhere. As you can see, sole proprietors, part-time workers, others. I think as you look at the gig economy, you're looking at a group that may be growing from the size of the individual market. Although I think what we've seen in the last year or so is a movement outside of the individual market back into the group market as the economy has improved. I think it's important to note there are a variety of ways that folks and by the way, this is based on our presentations that we did in the state of Wisconsin to the legislature and others to sort of understand the process. So if you know all this, I apologize for taking a step back. Obviously, a lot of people get their coverage through the exchange, and there are a variety of ways you can get coverage through that exchange. There are folks that get the tax credits or the subsidies as a piece of this. There are cost-sharing reduction subsidy plans which sort of attach for certain other income levels. And there are also folks who are unsubsidized. I think one of the biggest misconceptions that we saw as we went through this process is the people who purchase coverage off exchange. First, Obviously, similar to the unsubsidized on-exchange, they don't receive any subsidies. And by and large, they have the same plan designs, the same costs, the same sort of look at the plans as they do on exchange. There may be some different insurers in those markets, varying state to state. There may be some additional plan variations, but by and large, they have to sort of live by the same rules. Now, what we saw in Wisconsin, I think, as an issue, this sort of encapsulates the first part of the issue, which is we saw an increasing number of insurers exiting our market. So you can see in that first year that we saw a big exit, there were 37,000, which is roughly about 15 to 20% of our individual market lost their coverage and had to get new coverage. And when you move into the 2018 year, last year, going into that year, about 75,000 folks had to pick a new insurer. So we had a number of folks that exited the market. This sort of encapsulates the issue. I think if you look at those three versions of the state on the right-hand side of the slide, you can see that there's a movement from a lot of green to a lot of yellow and red. Obviously, we picked those colors specifically. Yellow and red indicate yellow, 2 insurers, and red equals 1 insurer in the state. You can see where the risk level goes as we went through the process as to where our concerns were. And it's important to note that these are not uncompetitive areas for other lines of insurance. In some cases, they may have 10 plus insurers in their market, in the small group market. A lot of those insurers used to be in the individual market. So it's a very, those areas have tended to be very competitive. And it is the sort of nature of the individual market that has caused them to exit. So why did they exit? I think what you're looking at is a worsening of the risk pool, at least in the state of Wisconsin. Other states have seen similar issues. Some have not, certainly. But in Wisconsin, you can see that the risk pool is worse than the national average, both in the number of younger folks who purchase coverage and in the number of older folks as a percentage who purchase coverage. And it's a very big difference from the market in the pre-ACA world. I will also note, if you take a look there, and I apologize for running together a little bit, those loss ratios are catching. Now, loss ratio is the percentage of claims to administrative expenses. So the 94% loss ratio in 2016 reflects roughly 6% of administrative expenses available to be covered. That indicates that those insurers in that market, given that it's set at an 80% loss ratio, had a significant loss. And you can see in that last bullet that about the individual market in Wisconsin lost about $500 million in the first 4 years. Now, losing $500 million of capital has a huge impact on your insurance market. It fundamentally changes the nature because it's forcing the employer market and the large employer market to subsidize the individual market in the case of those losses, and that's why there were a number of exits. So Wisconsin does not have a huge staff available to sort of, look at these things and to be able to put together the numbers. So we went through an RFP process. We looked at a variety of firms. We had firms that had actuarial expertise. We had firms that did not have actuarial expertise. Ultimately, what we looked for was a firm that would give us some availability and would do some economic analysis and would have some ability to sort of cut the potential for the actuarial expenses and to come up with some creative ideas. So, and we needed to, I think it's also important to note that this process takes time in order to meet the guidelines that CSIO just talked about, that you have to gather your Office of Commissioner of Insurance or Department of Insurance, depending on your state, will need to gather some significant background data on the insurers to be able to understand what's going on in the market and to be able to make sort of some good predictions as to what any sort of solution would look like. We ultimately met with the governor, and we came up with these sort of goals. Now, the first goal that I did sort of list here is that we needed to impact the 2019 plan year. So we started this in 2018, and we needed to impact the 2019 plan year. That was the first goal. So some of the new guidance that CSIO has just talked about, that's giving additional flexibility, you may need to build in some additional time in order to be able to sort of do the analysis and go through the filing process, since reinsurance is sort of a 1332 on training wheels. We wanted to keep or expand consumer choice, obviously lower premium increases, stabilize the individual market, and that's sort of key is stabilizing the individual market. Our market was in a free fall. Governor Walker announced it on January 24th, our plan. Speaker Voss, as well as Majority Leader Fitzgerald, and the co-chairs of our Joint Finance, Senator Alberta Darling, Representative John Nygren, worked very hard with us in order to help craft the plan and to go through, and it was signed by Governor Walker on the 27th of February. So what it did is it allowed us to administer a $200 million reinsurance program, with the state picking up about 36% of the cost and the federal government picking up 64% of the cost. Insurers, in order for us to be able to track the numbers, insurers were required to file rates with the premiums both with and without the reinsurance program, so we would fully understand what the impact on the plan would be on our consumers. The net result was a drop in rates by approximately 11%. This actually represented a drop from real rates year over year. So premium rates decreased by 11% over where they would otherwise have been, but it actually resulted in a net decrease in rates across the state of more than 4%. We also had substantial interest in re-entering the market, including one carrier that did in fact enter the market that year. And obviously I'm not with the department any longer, but my understanding was there were a number of insurers that were taking a strong look at coming back in. Last major slide here, I think there's a couple of tips as we went through the process that I thought were very important for folks to sort of understand. I think first is we involved Socio in the process very early. Everything was kept confidential with them. We had no sort of issues, no sort of bleed off or discussion from anybody else or rumors about what was going on. That was extremely helpful in crafting the legislation that was required, putting together a plan, having an understanding of where the guardrails are going to be. Right now, insurers are deep into looking at the 2020 rates, so I think anybody who's looking at affecting 2020 would have to take action really quickly. So more likely you're looking at a 2021 impact. There needs to be significant outreach and actuarial analysis on the back end, and I think it's important to understand that that's going to be necessary for success. And again, we looked at a firm that had a CBO-style analysis, which cut the actuarial needs significantly and gave us some pretty good numbers up front in order to be able to sort of the legislature to understand where it was going to go. And then the pass-through funding, I think, is an important piece to understand. And the pass-through funding is the amount of money that the federal government is going to send back in savings back to the state to help pay for the program. I think if you look at the recently released guidance, there have been some issues surrounding it, but I think if you're budgeting conservatively, and I think with the new guidance that has just been issued to understand the process, I think you can get a good read on where the numbers are going to end up landing, and some of the snafus that happened this last year are unlikely. Reinsurance, last point, reinsurance will not solve all the problems. I think the new flexibilities that were provided give you some guidance to be able to find some other solutions, some other ways to sort of be able to make this work better for your state. And I think there are significant issues. Reinsurance essentially shifts who pays for it and will certainly lower your overall cost, but it doesn't substantially change the insurance market in your state. So I think it's important to look at the options to get sort of there. With that, thank you, and at the end I'll be happy to answer any questions. You can see my contact information if you want to contact me directly, as well as information, direct information on Wisconsin's 1332 process. So I will turn it back over. Thank you.
Thank you, JP. And Michelle, if you would like to finish with our speaker portion, and then we'll move to Q&A. Thank you.
Great. Thank you very much. And on behalf of Senator Mac Middleton, I send his regrets as he's ill today, so I'm going to fill in for him. And I'll tell you a little bit about the experience we had in Maryland, what drove us to even consider reinsurance programs. So if you look at our history in Maryland, we were humming along very well in our enrollments, and you can see specifically between from 2016 to 2017, we saw a significant drop in enrollments. And that was about the same time, it was actually the same time that our transitional reinsurance program, the federal transitional reinsurance program, ended, and the state was providing a wrap to that. So we saw our enrollments start to decrease, and we also saw significant increases in our premiums, where they just really started to spike up, and we also saw a loss in our issuers, particularly the for-profit issuers that did not want to remain in the marketplace. So in response to that last legislative session, we worked in a wonderful bipartisan fashion with our legislature and our administration, and we put two bills forth. One would allow us the authority to apply for a 1332 waiver, and of course now under the new rules it's been loosened, so you don't actually have to get that requirement from the legislature. But we put that bill forward that would allow us to get to apply for the waiver. And then second, more important, was a funding mechanism for the reinsurance program. And that funding mechanism, we took advantage of the federal waiver of the health insurance fee, and we instituted a broad-based 2.75% assessment that allowed us to come up with funding to be used for the reinsurance program. How we decided on that mechanism, it was a good opportunity for us because the federal government had waived that fee, so we really worked with all of our issuers to say it's a fee that would have been paid, let's use it for our state, let's use it to start the funding that we need for the reinsurance program. We actually, the decision point was because we wanted to apply that assessment to our managed care organizations, it had to be a broad-based fee. So we applied it to everyone that would have had to pay the HIF fee, as well as any issuers where the state had the statutory authority to do that. What we exempted from that fee mechanism were premiums for health benefits subject to ERISA, as well as Medicare, federal programs, etc. Now, that what we found was that that assessment would affect issuers differently if we had not done that broad-based fee, so we actually just applied it across the board at the 2.75%. What that allowed us to do is we actually were able to have $365 million that we were able to collect under that assessment, and that in combination with the federal pass-through funding gave us almost $1 billion over the course of a 5-year period of time. So by just using that HIF fee was very significant in giving us a substantial amount of money to run the program with. We looked at this program as just a bridge to support our market stability in the short term and to provide our legislature with time to develop a long-term solution, which they are actually looking at during this legislative session. We had, when we filed the legislation, we had it be only apply for 1 year for 2020. So again, that's something we're looking at now, is how we can continue to collect additional revenue for future years. What we found with the funding that we did collect, it will allow us almost 3 years of the 5-year waiver to look at funding the program with a 30% reduction, or impact, I should say, on rates. The provision that we waived was Section 1312C1, which was the market index rate. So it allowed Maryland carriers to include expected state reinsurance program payments when determining their market index rate. We anticipated that the funding we have would have a 30% premium reduction offset. what the coverage that we estimated we'd be able to increase our enrollees by 5.8% in 2019. We actually, in reality, were able to increase that by 24%. So it was a huge impact for our state this year. The decreased premiums, decreased federal spending on tax cut, our actuarial analysis estimated that federal savings would be $280 million in the first year, $293 million in the second year, and $32 million in the third year. And then finally, we requested that the Treasury and HHS assist us in the state in implementation of the waiver through modification of the EDGE server so that we could actually use that EDGE server for the first 2 years of the program, and they very kindly agreed to do that. The next slide, I won't go through in depth, but it just gives you an idea of the funding that we were able to anticipate each year, and that what percentage of that was federal versus what percentage was state. In terms of our timeline, we had a very, very aggressive timeline last year to get this done. And as JP had said, most issuers are filing their rates by May, if not earlier, May, June timeframe. So they had to get this information in. We actually had our issuers file rates without the reinsurance factored in, and we had them refile in August. So our timeline, early March, we began working with a consulting group to get the analysis done. April 10th, in April, our governor signed the bills. In end of April, we released a draft application with a 30-day state public comment period. We held 4 hearings between the end of April and May 10th. And so it was a very aggressive timeline, and I can't state enough how much help we got from CISIO in getting this process done timely. So we collected lots of public comments, and then I'll just scoot on to the next slide to give you the outcome of what happened with this reinsurance. So here you'll see we had we have 2 carriers right now, CareFirst and Kaiser, and you can see that the rates that were filed were anywhere but increased from 18.5% to 91.4%. With the reinsurance, we were able to decrease all of the rates. And so the rates reduced anywhere from 7.4% to 17%. So overall, across the entire marketplace, in the individual market, rates for the first time in 20 years were able to be reduced. And as I stated, what that allowed us to do was significantly increase our on and off exchange population for the 2019 plan year. And I'll leave this last slide with you just to show the difference between whether it's bronze, silver, or gold, and where that premium range was. But in closing, I'll just state that the reinsurance program for the state of Maryland really has had a significant benefit, and filing the 1332 waiver to do so was a good decision on our state. We are looking at now how to continue funding for that program, and also looking at whether to continue to use, if at any time the HIF fee is waived, to use that as a benefit for the state and apply that assessment here in Maryland. So with that, I will turn it back to NCSL.
Great. Thank you so much, Michelle, and thank you to all of our speakers. We're going to open it up for Q&A at this point. Is there anyone on the line has a question? And if you do, if you could state your name and state and your position, that would be wonderful. So let's open it up for questions. Okay, so it looks like in our audience chat, we have a question from Jean-Pierre Cadernas, and the question is, would federal partners be able to describe how, through the new waiver guidance, states might be able to defray administrative costs under a reinsurance program? So our CISIO folks, Would you be able to give some insight to this?
Sure. So as we mentioned earlier, if the federal government is performing a function for the state as part of their waiver, the state can reimburse the federal government for those services. Idea being that sometimes maybe there's economies of scale and the federal government can do something cheaper. So Michelle from Maryland actually talked through this in a little bit in her slide deck. But for example, if you are a state implementing a reinsurance program, in our waiver concepts, we actually talk about this in more detail for folks who are interested. But we, outline two options. One, the federal government could administer the reinsurance program for the state in terms of like the calculation of the reinsurance payments for a state for the first 2 years of a waiver. The state would still be responsible for paying out to the issuers, but the calculation would take place with the information from the edge server. And it's also a benefit to the issuers because the issuers, are submitting the information once rather than having to separately send it up to the state and to the federal government as well. So in that case, the federal government can do that for a state, and our understanding is that it's, sometimes 1/3 of the cost that it would have cost the state to be able to do it. The other option is related to software and technology. So for some of the inputs that go into the edge server, we have offered an option where we could work with the state to kind of share some of that technology with the state, and in that sense, it allows the state to kind of gather the same information as the federal government collects at hopefully a lower cost because we're sharing some of that technology, and that does not necessarily have a cost associated with it, but it's something we can work with the state on. And so in our guidance, we talk about how CMS can do that for a state, and that's hopefully helpful for some states that are thinking about it. But to build off of that, there's also the federal infrastructure operational flexibility that we talked about. So for example, if you are a state doing your own state administered subsidy program, and you are thinking about, how will you do the verifications for citizenship or immigration, and maybe a state also wants to do a data matching process similar to what the federal government does, the federal government can do that service for a state at a cost. Idea being that potentially there might be an opportunity where the federal government can do that at a cheaper cost for a state. So hopefully those are some examples to kind of give you ideas of what we were thinking about.
Great, thank you. My apologies. For questions, you do have to submit them through the audience chat box. Are there any final questions? If not, we have a couple that we at NCSL can provide some feedback that we've heard on this topic before. Okay, well, I'm going to ask a question in the meantime, but again, if someone wants to submit, please do. Some questions that we've received on this topic, and this can be from JP and Michelle. To what degree do you feel like you were able to learn from other states that went through the same process or share information with each other when trying to apply for the waivers?
Yeah, so JP. So we actually had a lot of discussions with Alaska, Oregon, and Minnesota in describing how they put their program together, the specifics legislative language, and a variety of other topics, including the administrative after we actually passed it. So we had extensive discussions. I bet we had probably, maybe a number of other states too, I bet we had four or five conversations prior to us adopting it. And then when I was with the state, and they may still be having these discussions, we probably had 5, 6, 7 conversations with other states as well. So we had numerous other discussions. So states have been willing to learn from each other, and it's certainly something that if folks have questions, I'm certainly happy to answer them as well if they can't get in touch with one of the insurance departments.
Great.
And I would
Michelle?
just add to that. Yeah, I would add to that we worked heavily in looking at what other exchanges had done, and we actually used the Oregon model for our model. And so I would highly recommend don't recreate the wheel. We've been out there, we've done it, look at what's around. Everyone's more than happy to share and help. So use the resources that are available.
And one more thing, I would just add to that we've got that Wisconsin, if you're going to use an RFP process to look at a vendor and other things, other states have used them. Wisconsin's got a totally open records process, so you should be able to get the RFP from any of the vendors that we looked at. If you're looking at a vendor to get that information, so a lot of available help.
Thank you. For our Socio folks, the question that's come up, and I think you spoke a little bit about the new guidance and different things that have brought in. Can these waivers be used in concert with other types of federal waivers?
Hi, this is Lena. So there is a process outlined in the guidance for states to pursue Section 1115 and 1332 waivers together. As we kind of talked about earlier, the guidance is largely unchanged from the previous guidance, so there's no ability to kind of count savings from an 1115 waiver for a 1332 waiver, but if a state saw a benefit in coordinating to submit those at the same time, there is certainly a process available to them to do that.
Thank you. And one final question. This comes up quite a bit for this and other waiver programs. So JP and Michelle, and if the federal folks have something to add to, how involved, to what degree are state legislative staff in this process? We know it can vary state to state, but sometimes it's good to give a sense to our legislative staffers what their involvement could be, or maybe it's minimal. We'd love to hear from you guys.
So I guess I'll go first. So we had a lot of discussions with legislative staffers in putting it together behind the scenes. I think, so I happen to chair a work group at the NEAC, the Healthcare Reform Alternative Work Group as well. I think the variance is exactly correct. There is a push and a pull, but clearly, given the legislative requirements, it's vital to sort of understand what's going to pass muster in the legislature, and it's vital to sort of explain everything and to make the case, to be able to make the case of what's going on to fellow legislators and through the department. I was associated with the department, but to work through that process, it was vital for us.
And I would second that. We worked very closely with our staffers, and especially if you're looking towards any funding mechanism, the rules have been loosened, so don't necessarily have to get something passed to file the waiver. But again, if you're looking for anything that's going to involve the legislature to make a decision on, it's critical to engage them right up front and be very open with the information.
Hi, this is Lena. So from the Socio perspective, we are often working with the state, and, hearing about legislation from the state that's happening at the legislator level. We also, hear from legislators and staff themselves as they're kind of thinking about different waiver ideas and authority. So just emphasize, it's really, we want states to succeed in this process. We want them to have an application that's complete. And so we definitely encourage states to talk to us early in the process about their legislative authority to kind of meet the state plan. And so, the state plan, as you heard today, might be the authority to pursue a waiver. If your state has a funding need, that is also part of the state plan as well. So we definitely encourage states to talk to us as they're thinking about this process. And, appreciate working with you all.
Great. Well, that's all the time that we have for today, but we want to thank you again to all of our speakers for joining us, and thank you to everyone that joined today's webinar. If you have any follow-up questions, please don't hesitate to follow up with NCSL staff, and the speakers today all provided their contact information. Thank you to everyone, and have a great day.